again. I am Mama C with CHD Connects Hearts. And as you guys know, we do some video interviews of patients, caregivers, medical professionals, and those involved in the CHD community. And today we have the most lovely Delkia Fuller, who just got married recently. Congratulations.
Thank you so much,
Oh,
Mama
show that
C.
bling off. Let me see that. Oh, she got her thing. So I'm going to share with you a little bit about Delkia. Delkia is 30 years old. I'm sorry, girl. I just took months from her. She is 29 years old,
Almost
almost
30.
30, and she is an HLHS survivor and thriver. I can wait to
hmm
hear what this girl is doing and what she's already done. So she started out at Children's National in DC, and she does not remember who did her surgeries, but she was with Dr. Sturry and Dr. John from pediatrics all the way through the adult program until she moved from DC to Atlanta, Georgia. So she's my neighbor now because we're in
Yes.
Tennessee. She's in Georgia. So she's like right over there. And now she is with Emory Adult Cardiology. Yes.
hmm
And her doctor there is Dr. Harden.
Yes.
She's been there since 22,
21.
21.
2021.
21. I didn't write that number down. So, Miss Delkia has had 5 open heart surgeries. She's had the Norwood, the Glen, the Fontan,
Yep.
starting out at a week. And then in 2018, she had her mitral valve repaired at 2013 at the
Yep.
age of 18.
Yes.
Mitral
There you
valve
go.
repair. And then in 2021, at the age of 21, yes,
25.
25, she had her mitral valve replaced
Yep.
because it was continuing to leak.
Yep.
Great news is last year she had her stress test and everything was great. So
Amazing.
amazing. She's also had at least 30 cats.
I
At
lost
least.
count. We lost count.
Yes. So what she is doing nowadays is she is an entrepreneur. She started a nonprofit organization called One Hearts. She started about 3 years ago, but has officially launched this year.
Yep.
And that is how her and I actually
Yep.
connected. And I love it. She's also, like I said, an entrepreneur. So she is also working on her own business,
Yeah.
and it's a home health care business.
Yep.
Yes. So she's working on her own healthcare business as well. One other little feat that she's already achieved at this young age of 29 is she has wrote a book and
Yes.
published. Yes. So there is my little recap of Miss Delkia Fuller. Look, look at her. Oh, let's see. Show me.
Oh, yes, this is my book.
The Journey of a Warrior. And from what I've seen and what I've heard of this one so far, she's definitely a warrior. Like I said, she's not just surviving, she's thriving.
Yes.
So what do you want to share with those within the CHD community and those with, outside of the community? What is it that you want to share with us?
Ooh, what do I want to share? I want to share, first off, thank you so much, Mama C. I appreciate it. I appreciate this opportunity, but I really appreciate what you're doing for the CHD community. It
Oh,
means a lot to not only me, but all of us, which brings me into what I want to share because a lot of people are unaware of CHD, as we all know, right? We know the statistics, we hear the stories, but I just want to share that CHD warriors are just that. We are alive, we are thriving, and with all of the nuances, with all of the technology nowadays, it is improving, but there is no cure. And so, my main goal, just not even with my One Heart nonprofit, but just in life is to be the community, right? Be that bridge to fill that gap to say, hey, we have people like me who are 30 and we're the old hags of the CHD community, right? Like they're like, wait, you guys are living, we have to be innovative now. And then you have those new parents who are just finding out about diagnosis. You have those babies, you have those teenagers who are just learning what it is to advocate for themselves.
Yes.
So I want to be that gap, right? I want to be the bridge between that gap to build the community because it is necessary. We go through so much as CHD warriors that a lot of us don't talk about. And having the community is really what pushes us to thrive and to be that warrior. So that is my message. We need to be the community. We need to build
Yes.
the community. And it's
So,
so amazing to have people like you, right, who are advocating and helping us advocate and bringing us together to be one. It's not we're scattered here, 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 and there. We are one, and we
yes.
need to be one heart, right? We're one
Yes.
big heart together. So
Yes. I
that's my
agree with
message.
you. Allergy season, and it is
Listen, allergies and the weather has tanked in just 24 hours.
in 24 hours, we've gone from 70 to 40 with
It's
winds,
tanked. No worries.
and it is kicking my hind end. You said a couple of things in that little segment right there that we've got to dive deeper in.
Yeah.
Number one, you mentioned this the other day, and there's so many different aspects of the CHD journey
Mhm.
that need emphasis.
Yeah.
But one that you made the other day, and you made it again now, was how you all are here. And,
Mhm.
this has only been going on for 30, 40, about 45 years.
Yep.
So we now have all of these adults who have survived this and entering into this adulthood community.
Mhm.
And realistically, I, like you, don't think the medical community expected this
Yeah.
many people to live.
Yeah.
Would you agree with that?
I agree. It's but and to add on to that, not only are we living, but there's like we've discussed before, there's over 18, over 20 different types of CHD. And honestly, they're still finding new ones. So
Yes.
they're still finding new CHD. They didn't expect us to survive this long. And so now we are the research. But even in that, we don't have the community, right? We don't have the effective resources. The resources are there,
They're
but
all there.
we have to find them. And it's
Yes,
so hard to
it
find them
is.
and bring them present.
Yes. And it shouldn't be that way.
It should not be that way.
Not this far into the game.
Nope,
Yeah.
not
Which,
this far.
like you and I talked, that's the reason that I built this ecosystem.
Yep.
It's like this is it's time.
Yeah.
It's just time. So,
Yeah.
yes, I totally agree. But the other thing you said, and this is the one I really want to dive deeper into, and you mentioned all the things that you guys go through.
Mhm.
And you said, but we don't talk about
Yeah.
it. Why is it? Why do you think it's, I don't want to put words in your mouth, but
Mhm.
my thought process has been I think about a teenager and I remember what I was like as a teenager. And in
Mhm.
my life as a teenager, I was going through something, doesn't matter what it is, but I was going through something that was very difficult in my life as a teenager. And I
Mhm.
didn't talk to anyone about it
Yeah.
at all. I just didn't talk about it. It was just kind of my thing.
Yeah.
And part of it was shame, part of it was guilt. So I didn't want to bring attention to myself about it because I already had shame and guilt associated with it.
Yeah.
So
Absolutely.
is that something that I won't say all because I don't believe all would, but
Right.
is that something that a lot of the CHD patients, the heart warriors out there, is that something that they deal with?
I think it is. I don't think maybe the shame, but I think it's more so of guilt. And like you, I can't speak for everybody, so I'll just talk about myself. For me personally, I'm the oldest of five. So my mama was crazy. She had me first and then had more
You
kids
kept
after
having babies?
me. And I'm like, you already have to deal with me. I have that older sibling syndrome, if you will. And then you don't want to feel like you're burdening even more on top of the burden that you inevitably are in some aspect, right? And so when we
Yeah.
are having those days of we're feeling down or we are feeling sad or we're going through this emotional wave that we can't pinpoint, we don't say anything. We'll figure it out. We'll get through it. And that's just what we do. I don't think that it's some people it is shame because this is new, especially for the school age kids. I have this big scar going from here to the middle of my, like right above my abdomen. When that scar is out, you kind of hide in that sense. Now I'm an
Oh,
adult. I don't care, right? Like my scar is me.
yeah.
But as a child, as an adolescent, there's shame associated with that. There's this discomfort, if you will. And then you have to advocate for yourself. You don't know what's going on. And then there's just life. There's so many things going on. And me, oftentimes just don't want to be a bigger burden. And so we just,
So how does that show up? I mean, just give me an example in a family, just daily family life. Like you're going along. I mean, how does that guilt show up for you? How did it show up for you?
how did my guilt show up? I think I overcompensated internally a lot. So, for example, in my older sister role, I would make sure that I'm trying to do a lot for my mom and be an older sister. Not that she required it of me, but I would try to, make sure the house is clean or the kids are taken care of. Mind you, I'm only 10, but I'm like, let me make sure I do what I can do and help out, because you just don't want to be a burden. I'll give you a prime example. I remember this like it was yesterday.
Good. Okay.
My mom was at work and me and my siblings were at home. I was teenager, early teenager, and I was having an episode. I was having heart pains, chest pains,
Okay.
and I didn't say anything. I just never say anything. I didn't say anything, and I waited till the very last second, and I was like, I can't do this anymore. And so I ended up going to tell my mom, and I don't remember nothing after that. Let's just say that.
Okay.
I went to the hospital, like kind of blacked out. And it's just like, why didn't you say anything earlier? Why would I?
You just
I'm
didn't want to
like,
be, you didn't want to be a burden.
I didn't want
Okay.
to be a burden, right?
Okay.
So
Yeah.
that shows up in us feeling chest pain and not saying anything until it's absolutely terrible and we can't bear it anymore.
And it doesn't sound like your mom or your family ever gave you a hard time, or
No,
it was just you didn't want to interrupt the
the flow of things.
flow of things.
I always say I think that my family was always there waiting for me to come crumbling, and I just never did.
Did you sense that? Did you feel that?
Um, I don't think I now in hindsight, it's 2020. I think yes, in the sense of they would, if I say something like, if I do, they notice that I am slowing down, they'll ask me 1,000 questions, like, take your time, slow down. I'm like, no, I got it. Like I can go run, I can lift this 20-pound bag. And so they were always expecting me to kind of crumble and be just, I don't want to do this anymore.
Did
And that's
they did they treat you like you were fragile?
no.
Okay.
No, I don't. I think that's what I appreciate the most. I was active. I cheered, I danced, I played all the sports. I had to learn my pace and not overdo myself
Yeah.
because I can't run as fast as everybody. I can't keep up as fast as everybody. And so there were times when they would treat me like I'm fragile and I would have to sit down, I would have to sit out. That hurt my feelings, right? And
I
so
bet.
that goes into why don't we say anything? Because if we do, we're already having eyes on us like a hawk. Granted, because our parents are scared and precautious, but we don't want that. We want to go run around with the kids.
So you did, I'll say, so your parents they didn't necessarily treat you like you were fragile, but you knew, you sensed that they were always watching and waiting.
Oh yeah.
And
And like I said, there were times they're like, nope, you can't do that. Nope, you can't go.
because they know you.
Right. They know
Yeah.
I'm gonna overdo it.
They know you enough. Okay. Okay. So that's interesting. And do you think that that contributes to your drive to prove that you're, you know,
Yes,
I
I
mean,
do.
really?
I
Yeah.
do. I do.
Yeah. And
I
that's not a
think
bad
that's
thing.
every
Not a bad thing.
CHD. That's every CHD person. I think we already have the stigma on us. There's already this expectancy that we can't do but so much, we can't go but so far. And so when we are in the position to say, not me, I
Yes,
may be
I
in the
can and watch
1%,
me.
right? Like I may be in the 1%, but I am not in 1% in this. I'm 1% in this, not in this.
Oh,
Absolutely, it pushes it.
I like that. I love that. I gotta write that one down. 1% in this, not in that. Okay.
Not in this.
All right. So that's one thing that I think is really big. And it shows how big it is and it shows how small it is. All
Yep.
in the same sentence. Because so I was talking to somebody about the teenagers. Let me turn my phone down. I was talking to someone about the teenagers. And if you have a teenager who has a congenital heart defect that does impact their lives, because there are some out there that, the hole in the heart, once they fix that, it's not really going to impact their lives, right? So there's a lot that still impact the life. And
Hmm.
I just I just because my grandson, I think about his life. I think about his future. I think about the things he's going to run into, the things he's going to, come up against.
Yeah.
And I kept having this vision of him being this high schooler in high school and him having a struggle with this and having absolutely no one to talk to.
Yeah.
And it bothers me because only someone who has CHD can understand that 1% of him.
Yep.
No one
Yeah.
else is going to understand that one part of him. And the odds of him having someone in school with him is slim to
Slim.
none.
Slim
And
to
even if he has someone in school with him, how are they going to know?
right.
So,
Right.
okay, so I'm not
And it
far.
won't be HLHS, right? If you have two CHD people in the same room, they have two totally different. It's so rare to have two CHD patients with the same CHD.
It's yeah.
So
So,
rare.
that's the reason that I created that teen community. And
Yep.
I I'm putting this bubble around it.
Yeah.
So y'all can go in here, be safe, but I
Be
mean,
safe.
we're gonna know who's gonna be in there with you too. So, but yeah, so that's why. That right there is why. So that when you have that day that you don't want to tell your parents, I got really super tired today because I really pushed myself. Because you don't want to tell your parents that, right?
Yes.
Because they're going to
Absolutely.
be like, you know, but they can say it to another person with CHD.
And I think that it comes with really just knowing yourself. I may not have to say it to my parents, but I know I'm going to tell myself, okay, slow down,
Yeah.
sit down,
But what
calm
if you
down.
had somebody to talk to?
I
Would that make a
think
difference for you?
I think so. And I'm going to say this. I have a cousin. He's younger than me. He's a boy. He has dwarf. And so double outlet right ventricle. He has dwarf. He has dwarf. He's younger than me. And so every time his chest hurts, if he coughs too hard, if he sneezes some way that he don't like, he'll call me. I
Because you are a safe place to talk.
exactly. So I understand that it doesn't matter if I'm 600 miles apart or 6 steps away. The community knowing that somebody there that understand makes a difference. Granny, he may be hard-headed because I'm calling and telling him, "Did you go to the doctors today?" He may not have gone, but he
How old is he?
knows he's, I'm 29. I think he's 26,
Okay.
but he knows he can call me,
Yeah.
right? The community makes the difference. So it gets to the point where he's like, my chest hurts or something. He just had his second open heart surgery. And he's like, call your aunt. I'm tired of her being down my throat. I'm fine. I'm just like, what are you doing? Did you take your medicine? The community matters. Your mom, your cousin, your sister, your whoever can tell you something. But if you have somebody with CHD, you're more prone to listen to them.
It's true.
It makes a
And
difference.
and I also think that it's not just someone with CHD at that point. Like teenagers, if a
Yeah,
teenager is told something by mom and dad,
exactly.
and then they're told by another mentor,
Yep.
they're gonna listen to the mentor,
Yep.
and they're not gonna listen to mom and dad half the time.
Nope.
They'll listen to the mentor.
Yep.
But that's the thing, I've talked about this often is we're not just raising a child with CHD, we're still raising a child.
Yep.
And the goal is still to raise them to go out and go become
Be
functional on
productive.
their own two
Yep.
feet in society.
Absolutely.
And and I cannot imagine my daughter, how hard it's going to be on my daughter when Hunter, my grandson, starts doing that natural progression of pulling away.
Yep. Yep.
It's going to break her
Yeah.
because these CHD parents, their bond is
Oh
different
yeah.
than
Oh
a
yeah.
parent, normal parent. I'm experiencing it.
Mhm.
I'm seeing it. I even notice a difference in me as a grandmother.
It's still a big difference.
It's different. So, we have to remember that they're going to pull away and
Yeah.
you're not going to be managing their care
Yeah.
and their advocacy and their daily function like when they're little.
Hmm.
That's a different game with CHD.
I even laugh sometimes because I'm always like, a CHD parent may have it harder because we feel like we have to advocate so much. And so we get to this point in teenage years where we're like, we even got to advocate for ourselves against our parents. And so not only are you going through the adolescent stage, you have somebody, a child, a teenager who's like, I know my body. You don't feel what I feel. I can go run. And you're like,
Yes,
no, you can't.
yes,
No, you can't.
yes.
So trust me.
Awesome though. I mean, it just amazes me how in depth it is. Every
Mm.
conversation I have, it's just that little bit more of a reminder. So I do want to ask you, now that you are newly married
Mhm.
as a woman with CHD,
Yeah.
what about family? Are you thinking about family, or how does pregnancy work for you? Is
So this has always been that conversation. I call it the P word conversation. This is the P word conversation. I honestly have been having this conversation for a few years. And when I say a few years, I'm talking teenage years. Not that I was wanting to be pregnant as a teenager,
Yeah.
but I knew that I had this condition. And so I wanted to, I'm always about give me the information now. I'm gonna do my research, but I need you to tell me. And so at first it was a blatant no. My doctor
Okay.
literally told me no. I remember my
Now that
doctors,
was that in DC or in
that
Emory?
was at DC. Yep.
Okay. All right, go
They were
ahead.
literally like, no, you can't do it. And mind you, I was grown. I was, well, not grown, but I was an adult by
You're
this
an
time.
adult. Yeah.
24, 23, having this conversation.
Yeah.
And they were like, no, you do not need to get pregnant. I pretty much prohibited me from getting pregnant. And so this is where I'm a big faith girl. Like me, God, we're best friends. And so I had to constantly have that conversation and take it to God in prayer because I think the more I was told no, the
The more you
more
wanted to.
exactly.
You remember earlier when we were talking about that little girl still inside us?
Uh-huh. Exactly. And so it went from, well, me putting my hands on my hips and telling you you can't tell me what to do, to okay, I actually have to think about this because now I'm actually an adult. I'm actually married. I have to really think about this. And so now we really have to sit down and have a serious conversation. And so my adult congenital heart, they were like, I don't want you to do it. It's more stress on us than anything.
Get on you.
It's they're like, it's more stress on us. Like, I don't want you to do it. Giving me your heart doesn't pump like this. It's not going to produce all the blood. Your baby's going to be premature. We've had the conversation
Oh,
and
tell us what they're saying. So
they are okay. So
because of the difference in blood flow.
yes, so with
Or
hypoplastic left heart, we don't have the right ventricle. Sorry, we don't have the left ventricle. It's not there. And
right,
that's the main source of blood flow, right?
yeah,
And so because of that, they're like, you're not even getting enough blood for your body. When you get pregnant, your body has to produce double blood flow for you and the baby.
yeah.
And so because of that, there is this uh fear, for lack of a better word, that yeah, you can get pregnant, but that baby's not going to survive because it's not going to get enough oxygen. That baby's going to be premature. You're probably going to have a miscarriage because it's not going to be able to survive.
Right.
And if the pregnancy does last, you're going to be what they call um I forget the acronym, but it's pretty much the baby's going to be small. It's going to be really small because it's not growing properly because it doesn't have the right amount of oxygen and blood flow and
And
all
then
of that.
higher risk of birth defects.
Yes, and of course, high risk of birth defects. At first, they were saying, "Oh, you're definitely going to get a cesarean. We're not even going to think about letting you push."
Yeah,
But then my doctor is like, "No, we're not going to cut you. You're going to push. It's lower risk for you to
lower
push.
risk. Yeah,
You're just going to expect a whole room full of people just in case.
yeah,
Of course, I'm going to have to stay longer in the hospital. The baby's going to have to need more intensive testing." And
sure.
so they're like, You can, but please don't." um,
Big difference from no, though.
right. And
Yeah,
I've heard no for I've got the you can in the last year. So I've went 28 years of being told no.
but what is it you said? What is it you started out saying? We are the research.
We are the research.
Yeah.
Exactly.
And
And
I'm pretty sure, I'm almost positive. I know of one HLHS mother that has given birth. I
that's
think
the
I've talked
thing.
to her. I have to go back and look, but I'm pretty sure.
I think a lot of CHD patients, particularly HLHS, because they pretty much scare us away from pregnancy. A lot of us just kind of renege and say, okay, well, we'll just adopt or we'll just do surrogacy.
That's what I've heard a lot. Yeah.
And I may just be
Well,
hard-headed.
I mean, it even if they okay, let's just say it's obviously going to be a higher risk. It's
Of
going to be
course.
risky for you. It's going to be risky for the baby.
Yep,
And I can understand why the majority of people would say, I'm not
absolutely.
risking it.
I'm not risking it.
Yeah, I get it. But you're saying you're willing to risk it.
I'm saying if I'm the research, I'm gonna do my research and we're gonna get it done.
Okay.
That's what I'm saying.
Yeah,
Now, is that other conversation always there? Absolutely. We've we even started or attempted to start the surrogacy process, but that was kind of a kick in the throat for me because I have HLHS, because I have the CHD. It wasn't a simple, oh, we can just draw your blood and do
no,
no. They're like, you need to go to the hospital. We're not doing this. You need to be put under. It's a whole surgical procedure. And I'm like, why?
right.
So
Well, all right. So I was talking to another a couple of women the other day, and she's an adult. She just had transplant,
oh,
and she was telling me that one of the things that she has struggled with and doesn't understand as much that needs to change is how many doctors are out there for things unrelated to your CHD that
Mhm.
will not do procedures or anything on you
Nope.
because of it.
Yep.
And how frustrating it is just to get
Yep.
something simple
Yep.
that should be simple to even get anyone to do it.
Yeah. It's like, oh, we can't touch you because we're the biggest liability ever. Like, oh, because you have this, if you get your wisdom tooth pulled wrong, it's a problem. And I'm like, well, you're a dentist. That has
Yeah,
nothing to do with my heart.
that's your
Like,
specialty.
right. So,
You're not talking about, you're
yes.
not doing anything by heart.
It's like, yes, I know that I have to take the amoxicillin before the procedure because I'm probably on a blood thinner, right? I know I have to stop this medication because I'm probably on a blood thinner or I'm higher risk for infection. Give me the antibiotic. Tell me to wait the 30, the 3 days, however long, and pull my wisdom tooth.
So how do we address that? How do we deal with that? And I don't, well, let's back up. One, I could say, I don't think we can ever deal with it until the community is joined.
Yep.
That's not even an option. But I think once we join it as a, as we join as a community, if we can get that step done, I think
Mhm.
things like this have a chance of being addressed.
Yes.
But
And
I
I
don't think
think,
that'll happen until we can get a conjoined community.
no.
Do you agree with that?
I agree, and I think to answer the question for the now, right now, it's all about self-advocacy.
Okay.
And
Talk about that.
we really have to self-advocate. Like I myself, we were talking about this earlier. I started out on 10 medications after my
Yes.
post-op. I was on 10 medications, including Eliquis. I was on warfarin. I
All of it
had
was
to
and warfarin? Warfarin?
no, I started on
Oh,
warfarin and then I fought to get off of warfarin.
and they put you on
They
Eliquis.
put me on Eliquis and then I had to fight to get off of Eliquis.
Well, I'm
And
glad you said that you corrected that because I thought you were on both, and I was going to say
no, no, no,
here
no, no.
because you can't even nick yourself shaving on both.
No. I was on warfarin first. Of course, that's the harder drug.
Yeah.
And then they put me on Eliquis and then I got off of that. That was a lot of advocating. Of course, post-op, like I said, I was on 10 medications, three different kinds of blood pressures, of course, the blood thinner, and then slowly but surely they started to trickle off. I started to get a little healthier. I was after my last open heart surgery in 2021, you have to it puts you down for about 3 months.
Yeah.
That was the worst recovery I've ever had.
And I mean, listen, the older you get, the harder it is.
That was the worst recovery. And I think because this time I was an adult and so I was more aware of what was going on
Yes.
versus, yeah, I was 18, but I had just graduated, so I was still the baby and everyone was,
Yeah, but still, look, you had a repair done
hmm
at 18, and you had a complete, you know,
exactly.
they replaced it. That's a big
Yeah.
difference too. And it was the bovine, you said.
Yep.
So it is still a foreign object. Your
Yep.
body's gonna have to be, it's like going, wait a minute, what is
What's
this?
going on? Yep.
How do we adapt to that? What do we do? So yes, of
It
course.
was, I think my more recent one, my most recent open heart, that was hard. And that kind of brings into everything we've been talking about, from the advocating to how do I react and respond with my family. Because I think that was the first time where I was like, I am so done with being here. Like I went through that
Um,
mental space of
yeah.
like, I don't even care anymore. I don't want to do this anymore. And it's like, no, you don't get to that point, or I didn't get to that point where I'm like, oh, just take me out. But
But
I
you
was
thought about it.
exactly like I was
Yeah.
probably a step away.
Yeah.
And I
But
didn't tell
the thoughts were
anyone.
there. The thoughts were there.
The thoughts were there, absolutely.
Yeah.
And I think I shocked myself because like I said, I'm always bubbly. I'm always happy. Whenever I talk about my condition, I'm like, I'm thriving, I'm here. But that time I cried for the first time. I When I say my family was waiting for me to collapse, they got it that
You
day.
got it. Yeah.
And the crazy thing is, they still didn't get it in the capacity that they wanted to. I went to my
Oh,
grandmother and just had a little mini, I'm just annoyed. I don't want to do this. I'm tired of this. 5 minutes tops. That was it. But I had been thinking about this for months and months, not saying anything. And so, yeah, so that started, and then recovery was horrible. It wasn't horrible, but it was bad enough to be horrible. But I recovered really, really well.
that's good.
I
But
recovered really well.
I'm glad you were willing to share that,
Yeah.
because I think I I would dare say that the more, you've lived this, so correct me if I'm wrong.
Mhm.
But I'm pretty empathetic, and my sense is, growing up with this, you're different,
Mhm.
something's there, but the big surgeries are when you're very young and you really don't remember them.
Yeah.
You have the outward scars from it, but you don't
Mhm.
remember it occurring so much.
Right.
You've got to go in and out of the doctors, but a cath that doesn't hurt.
No.
They put you under and you wake up groggy, and it's like you took a nap.
Yep.
So there's no real repercussion coming from that.
Yeah.
So as you get older and then you experience the truth of it,
Mhm.
then all of the things just kind of come together, all the things you've heard
Yes.
that were one step removed, because you don't really sense it, you don't really feel it.
Right.
Am I right so far?
Yeah. Absolutely.
Okay. And then all of a sudden you go, oh, now the totality of the reality sinks
Mhm.
in. Is
Yeah.
that accurate?
And absolutely. And I think even to add for me, it was like, okay, we're here. And you have to add back to advocating for yourself. I had to be, okay, when do you want your surgery to be? What day are
I
we
don't
coming
want my
in?
surgery. I
Right.
want it
Like,
in.
what time are we coming in? Are you going to go to work? You got to take off for work. Like, so now you're including me? Like, now you're making I have to plan this? I
Yes,
don't want to
yes.
do it.
Yeah. Can I
So
just say no? I mean, can I just
that's
say no
always
and just pretend, just go on?
listen.
Yeah,
It's a part of the journey, but I think that's what makes us more resilient. The more that we have to advocate for ourselves, the more we learn about ourselves in that, the
right.
more resilient we become, not only as a CHD patient, but as an individual.
Absolutely.
You learn to speak up for yourself one way or another.
Yeah, yeah.
So,
Was your mom and your family involved in this last two surgeries?
oh yes, my mom comes to everything. Even when I had my most recent calf
Yeah.
last March, my mom flew to Georgia.
Okay.
She's not going to miss a surgery. Yes, my family was very involved. My recovery was on my grandmother's couch. um, they were very involved, but I did good with this surgery. I was out of the hospital in a week,
Oh, good.
mm, in 10 days.
That's good.
I
Yeah.
was out in the hospital in 10 days. And normally they expect at least 2 weeks recovery. Get me out of here. Get me out of here.
Hi, Delkia.
So get me out of here. And I did good. I was out in 10 days, and they're very, very support. They were very supportive.
So how about your husband? How long have you known him?
So we've known each other. We got married on our 3-year anniversary. So this year would be our 4th year of knowing each other. He is I think he got it easy, honestly. Because I'm older, I know how to advocate for myself. I think he's in I try not to do this, but he's still in that space with like my family, right? Like if something's wrong, I'm not going to tell him until until it's necessary. But he's
Hey, Delkia, who do you have to talk to? You've got
you.
somebody. Get me. I'm calling
You.
Mama C. Listen, my heart hurts, but I ain't telling
Listen,
anybody else.
absolutely. Don't tell nobody. I'm going to go to the doctors, just not right now. I know they're gonna put me on a Jello liquid diet. I'm gonna drink this Kool-Aid, this soda. But no, I definitely he's hawk eyes on me too, but he knows. Like if I sometimes I'll do like an extra breath when I'm talking, if you'll notice, and he's like side
Really?
eye. Yeah, he's like, you okay? He's very in tuned. He has all the things. I'm like, you're my emergency contact now, okay? You have to know all of this information. And it's always funny because he can never tell me what HLHS stands for. He's like, I know what it means. I know what you have. I just don't know how to say it.
Draw the picture. I was
Listen,
going to say the
I just
words.
don't know how to say it. But yeah, he's very supportive. Even with the nonprofit, he's like, okay, we're gonna hit the ground running. Tell me what you need me to do. Um, when I had the conversation about the P word conversation,
Yeah.
of course I had to have that conversation with him. And so he was like, put me on the phone with the doctors. Can we do a Zoom call? Can I be in the doctor's office? When I have to do my stress test, he'll be like, okay, when I have to go for my stress test, we'll go to the gym like 2 weeks leading up to my stress test so I can practice. I have a goal. I always want to get to at least 10 minutes. And so we always go to the gym together. He'll be helping me out with that, but
I
he's
love it.
super supportive.
I love it. So now is he involved in the nonprofit, the One Hearts?
Absolutely. He is
Yeah.
definitely involved. And because we're just getting started, he's, trying to support and advocate as best he can.
Yeah.
It's just, I think as this is my baby, and so I'm in those beginning stages, and I'm like, okay, let me make sure everything's together. I'll delegate as needed, but
You have a feeling you're like me. Delegating is not easy.
it's not.
It's
I
hard.
will figure it out. I
It's
will figure
not
it out.
only that, it's like if I have to tell you how to do it, I could have already done it.
I could have done it. Absolutely. Don't get me wrong, I will ask 1,000 questions, and I'm like, okay, I don't feel like doing this. Somebody else do it.
Somebody else could do it then. Yes.
Yes, but when
Yes.
I'm full force, focus, leave me alone. I'll
Yep.
get it done.
I'm the same. I'll be sitting there when I was building all this. I would look up and it was 1 o'clock in the morning. I'm
Yep,
going,
I will get it
oh,
done.
okay.
That's
How's
your
the
that's
roll?
your baby. You got to make
My
sure that it's
baby, how's
right.
the roll? So, yep. So
Awesome.
tell me what, if you could give me two primary goals that you want to hit with your One Hearts.
Ooh, two primary goals. Okay, so I'll give you a short term and long term. How about that?
Yes.
So, short term goal, I want to have a big turnout for my first event, which is my support group. I'm hosting like a virtual support group on April the 10th via Zoom. So, I'm trying to get that information out there and really have a good turnout for that because I just want the community to be established and built upon. Long-term goal, I want One Heart to be a pillar of many pillars, but a pillar in the community that really unites the CHD family, because that's just what we are. So that is going into those hospitals, being there to support those families, being there for post-op, right? Just like your ecosystem, being there for those conversations, really feet on the ground, boots on the ground, in the
Ask you a
streets and
question.
doing it. Yeah.
If money was no object and you were free to do whatever you could do, whatever you wanted to do, whatever your heart wanted to do, and your
Hmm.
soul, what would you do? Give me a week. Give me a week. What would your week look like?
Ooh, if money was not an
Money's
object,
no object.
I could do what I wanted to do.
Bills were paid.
Money was an object. I'm a traveling girl. Okay. I am going to go travel somewhere. I love to travel. If money was not an object, I would have constant in-person gatherings. I'm a people person. I want everybody together, always doing something. I love hosting. If money was not an object. So Monday, this is our week. Monday, I have hosted an event. Tuesday, I am planning to go out of town from that event. Wednesday, I'm out of town gathering community, networking, doing all the things.
Yeah.
Thursday, I'm coming back and I'm probably planning another event, whether that is with my family, something small and intimate, planning a big event, I love to throw a big party. Like I threw the One Heart Gala, my first gala in Atlanta, loved every bit of it.
What
And
about your husband? What does he do?
he's a pricing consultant. So he's all about the numbers. I don't like numbers. I be having to think about my oxygen all day. You can deal with numbers. So he's into the numbers, I'm into the healthcare.
Okay.
So same way, he doesn't actually like to travel, honestly. I said you married the wrong person.
I was gonna say that's the reason I asked the question is if he liked to travel.
No,
You know,
but he has
how's
no choice. He got used to it now. I'm like, our year is already set for travel. You know what you're doing. You knew what you were getting yourself
yeah,
into.
you're stuck now.
You are stuck now. You better learn to love it. But he's getting adjusted. He's
Let
had
me
3 years.
let me ask you a question. What if there was a way to do it virtually where you didn't travel as much? You still do some travel, but you get it set up virtually.
Do what virtually? Like travel virtually?
No, your group sessions, your group meetings, and
Oh,
yeah,
yes, I would. I'm okay with doing it virtually. That's why the first event is the virtual
it'll be
event
virtual.
because I think in today's age and time, it's more convenient. We love convenience.
It is.
And it's more affordable because gas is expensive.
All right, so then if there was one thing, and I'm gonna say besides self-advocacy, because I
Okay.
think that's where you would go.
Okay.
If there was one thing besides self-advocacy that
hmm
you would tell a teenager,
hmm
16, 18, 15 to 18 years old,
hmm
with CHD,
hmm
what advice would you give them besides self-advocacy?
Ooh, what advice would
I
I
made it
give
hard, didn't I?
a teenager? What did I deal with the most? Give yourself grace. Give yourself grace because it will get hard. And sometimes, how I always have to mention it, sometimes self-advocacy won't work. And you will hear the no's. I've heard no a lot. And so give yourself grace and be honest with yourself. Go to the doctor. As soon as as soon as it
Doctor,
starts to hurt, go to the doctor. While we know about ourselves, we could advocate all day long, go to the doctor. Don't try to figure it out and wait till okay, I felt 2 more beats than normal. No. Go when it hurts. Go
no
when
one.
you think it hurts.
So am I hearing you say, tell someone, don't keep it to
Yes.
yourself?
Don't keep it to yourself.
Don't do a Delkia?
Don't do what I do. Do what I say, not as I do. Do as I say. Don't do as I did. Tell somebody. Give
I
yourself
love it.
grace. Talk to somebody. Really,
Good, very good advice. Is
really.
there anything that you would like to add that we've not talked about?
Anything that I would like to add? Um, I think that my concern, if I do have one regarding the CHD community, is that we don't become corporate if you will. Having the individuals who are doing the research and having the people who do have the connections, and you are doing what we call gatekeeping. You don't want to share the information. You don't want to build the community. You want to keep it for yourself and say, oh, I have the answer. No, we are a community. And so I really want that to not become a thing
I
because
agree.
yeah, I don't want that.
Did you get a chance to read over what I sent you?
Yes. And of course, I'm going to say yes.
Yay!
Of course, I'm going to say yes. Of course.
So, did you get, the reason I asked it was as soon as you said that, it was like, I tried to weave that in to the affiliate program so
Yeah.
deeply.
Yeah.
Did you sense it? Did you see,
Yeah.
feel that?
And honestly, even before we even got to the affiliate program, that's just what I got from the ecosystem, right? It's like, oh, we have all of these tools, we have all of these tabs, we have all of these little communities in the ecosystem. This is what this is for. And so that's why I'm just like, thank you so much. it takes away the feeling of being corporate. We're not,
That's just it. Yes. I mean, there's areas for it and it
yeah.
needs, but for instance, see who's, Conquering CHD. They
Hmm.
have an area within in their foundation that has to be corporate, the
Yeah.
foundation side. They have to operate in that. But on a whole, for Conquering CHD, they need the connection with the community. So
Right.
the portion's got to remain that way. And that's the beauty of the ecosystem
Yeah.
that we've built with CHD Connects Hearts is
Mhm.
all of you all can come in here, you can do your thing
Yeah.
within the community. And then within that, within your organization,
Yeah.
you're gonna make the wheels spin.
Correct. Because business, I can understand, right? Business is business. You
This
have
is
to have
business.
those boundaries. You have to have those guards. It is a business. Or your
Yes.
organization is a business. It is a corporation. That's literally the name. So,
Yes. But you know what I honestly think is going to end up happening over time is I think you'll start seeing some mergers of foundations. If we can come together as a community, and it's not a bad thing.
it's not.
Some people will cringe when they hear that. But if you stop and think, if you have, if this community can come together within this ecosystem,
Hmm.
and then you've got, and I'm using numbers, let's say there's 6 different communities, all of different sizes,
Hmm.
trying to do the same thing.
Hmm.
Then if they can join into 1 or 2 of them versus 6 different and merge,
Hmm.
that's when you start having power.
And for the sake of the cringers, because I can see
I
why.
do too. Yeah.
So for the sake of the cringers, the maybe not the idea of okay, going from 6 to 2, but we're still 6, but we're sharing our resources. And I think that's the whole thing.
And that
Like,
could happen too. That could happen
yeah.
as well. But I think just like, I'm not, I mean, nobody be merging with me or with us because we're just the ecosystem, right?
Hmm.
But I do think that in time, I think you will see some people merge.
Merge.
Yeah, I
It'll
really,
be it'll be best for some people.
yeah, it could be better for some people. I mean, if you've got a foundation over here that's, done really well and has got their feet in strong,
Yep.
and you've got some of the newer ones that are struggling to make that dive
No
in,
doubt. Yep.
that claw in, then merging, but
It'll
they've
be
made
best
progress, then a merger at that moment makes more sense for the whole.
for the exactly for the
Yeah.
mission. Make the mission make sense. Make
Yeah.
the mission
So
make sense.
I think it'll be a natural occurrence. I think it'll be very
Yeah.
organic and
Yeah.
it'll happen behind the scenes. And we won't, none of us in the community will know until they announce it.
Nope. And we're just like, okay, as long as the community is being impacted positively,
That's all
everyone's
that matters.
happy.
That's all that matters. Yeah.
Everyone's happy.
Yeah.
I'm
And I
excited.
think part of that is because they're not even connected. They don't even know about each other
Right.
because they've got so much of this. So I think as you find people, it's like, oh, you're on the same mission as me. Oh, you're on,
Yeah.
let's do this.
And that's my issue because I'm just like a starter up, if you will. I'm the baby of the
Yes.
group. And I'm like, okay, I'm trying to find those.
Well, you're trying to find your spot.
Exactly.
Exactly. Well, and I'll be honest with you, that's how I found this spot.
Yeah.
Because the more I looked and the more I went, it's like, I don't need to create another group.
Right.
And I don't need to create another foundation. I don't need to create a research program. I don't need to create, those are already there,
Mm-hmm.
but we're all over the place. So
Right.
that's kind of why I did what I did. And honestly, it was a natural migration. I was looking for the hole and I found the hole and filled it.
And that's the beauty of it. It's like, okay, I'm not fitting in any of these places. I'll create my own
Yeah,
so that everyone can come here and be together.
yeah, yeah.
So I love it. I love it.
It's exciting.
It's very
I
exciting.
have so much excitement for it, and mainly because we are so young in
Yeah.
all of this, and there's so much more to be done.
And it's already such a great impact. Like you got the big hitters, if you will, right? You got the Conquering CHD, like, and it's already such an amazing, amazing impact. So I'm excited.
Too. Something really
So
strange
excited.
just happened over here behind me. I was like,
As long as you're safe.
I'm safe, but uh, I don't know what that was.
Safe but curious.
I'm
Don't
here by
worry.
myself, and the noises that I just heard was I'm not by myself.
Okay. I was gonna say if you need to take the blur off so I can make sure we do a house sweep.
Like, what weapons do I have? No, I'm just kidding.
Listen,
Just kidding.
always have a cup.
Yes. Honey, I once again absolutely enjoyed talking with you.
I love it. Thank
So,
you so much for this opportunity.
oh, thank you. No, thank you.
This
Thank
was
you for what you're going
amazing.
to bring to the community
I'm
because
excited.
you've got a lot to bring.
I'm excited. And thank you so much. I'm sure we'll talk soon.
You know we will. I'm going to go ahead and turn this off, but stick around with me for a second, okay?
Okay.
All
Awesome.
right. Guys, thank you once again for watching and joining us with CHD Connects Hearts interviews with Delkia Fuller. And I just have a feeling you're going to see her in the community. So come see us. Talk soon. Bye.